World has moved towards screening. Occasionally I do some rifle shooting, which is quite different.
So you think doctors are bad patients?
Stigma is the main barrier which is stopping
So welcome to the program, doctor, and it's a pleasure to have you.
Hello, thanks for having me.
So medical oncologist, tell us a bit more about your medical journey and what inspired you to take this path.
Initially, from my childhood days, oncology was something occult. So most of the specialties, even after MBBS also, I'm exposed to all the specialties in MBBS. But oncology is one subject which was occult. No one knows anything about oncology. So that intrigued me. So I did my MD from radiation oncology from Usmania Medical College. I did my MD in radiation oncology. I worked in radiation oncology for 4 years. After that, I wanted to do something more. So I pursued my DM in medical oncology. I did it from NIMS.
So were you a bookworm kind of a student, or you had your sports days, or you were an outgoing person? How were you like?
Predominantly, I was more into studies and all. But lately, I realized that there is much more into life, apart from books. So I'm pursuing different hobbies. Occasionally, I do some rifle shooting, which is quite different because swimming, rifle shooting, and I'm making myself more used to the things other than books.
So rifle shooting, hitting the bullseye,
Yeah.
Which pretty much is the same in oncology, I believe.
Yeah, exactly.
So talking about cancer in general, doctor, we always think, cancer comes announcing in a big way. But I'm sure with so many people around diagnosed with cancer, what are some subtle signs that we usually present with?
I'll give you one interesting story which I have recently come across. So I have one patient who's 24 years who just had a complaint of bleeding per rectum. So he misdiagnosed it as piles. So he went to a regional doctor. He said it's probably looking like piles. He did not do much anything about it. So after that, he started losing weight, and his parents are concerned. So he was into multiple hospitals. Eventually, he met one gastroenterologist who thought it is looking something different. After biopsies done from that lesion, it is diagnosed as stage 4 rectal cancer. So 24 years without any risk factors, you hardly see such cases. But this is a trend which we are seeing recently. A lot of young patients presenting with advanced stage of colorectal cancer. So something such as back pain, persistent back pain, we usually ignore. We take it cancer comes last in the list.
Yeah.
But if your back pain is persistent, coming regularly on the same site, and it is associated with loss of weight and loss of appetite, and it is not subsiding with your exercise physiotherapy, I think definitely you have to meet an oncologist to have an opinion, to get yourself checked, to rule out cancer.
Another common symptom we often, misunderstand is a painless lump. We think that, there's no pain and I'm sure it's not serious. So how do you think we should look at it?
So in females especially, now there is a lot of emphasis on cancer screening, breast cancer screening, where our motto is to let the person examine her breast, because breast parenchyma, the breast texture is different from female to female. So from younger age, probably from 25 years, if you are adept to self-breast examination, then you can easily find out what is the new change that is coming. So any lump which is painless, which is new, and which is growing over a period of time, that is definitely concerning. So after probably 40 years, we have mammography. Now, since the breast cancer is also moving to a much younger age group, so any lump which is painless and which is growing over a period of time definitely needs an evaluation, either ultrasound or mammography and a biopsy.
Do you think there's a good awareness about breast cancer and mammography since you got this point? How many people, you see day to day actually get this preventive screening test done on regular basis?
That's a nice question. I know a lot of doctors who are hesitant to send their parents for mammography. So that's a stigma. cancer stigma is still very prevalent at least in India. So that is preventing our parents and our like females who are in our family to get their screening mammography done. So if you break that stigma and get that awareness that cancer screening actually prevents deaths, then probably like we send more patients to cancer screening. So I think the stigma is the main barrier which is stopping our family members from going into cancer screening. And that cancer and all, it has become a very toxic word now.
Yeah.
So we are afraid of that. So like we don't want to invite any of those terms into our life. So that fear is preventing us.
So you think doctors are bad patients?
Definitely. So doctors and teachers, what I observe, are bad patients. So the reason being, we think that we are more knowledgeable. We tend to self-diagnose more, tend to ask less. That is the reason we get into this loop.
So another common symptom is fever. I'm sure fever is very common, especially with seasonal illness. But what about fever which doesn't settle with medications and which we often see it coming quite often? So how do you think we should see this?
Fever, especially which is associated with lymph nodes, in small swellings in your neck or in your axilla, in the armpits or in the groin region. If you're having persistent swellings and fever coming on and off, which is not subsiding after months and months of therapy, then it tends to be lymphoma, or sometimes rarely it can be leukemia. So that fever which is not subsiding definitely requires an oncology consultation.
Another common thing, people feel proud of is, losing weight and loss of appetite. They say, I've lost so many kilos and I look wonderful. My appetite is down and I don't have to hit the gym. So you think that's right thinking?
No, actually, it is always a balance of your diet and exercise. Now, people are more into this weight loss drugs and all, but I don't think that is healthy. The more exercise is not only about losing weight. It also have a positive effects on your bone balance, your muscle texture, your muscle quality overall, and it has a positive influence on your immune system. So now in cancer, there is something called as immunotherapy, which is just turning your own cells against cancer. So that switch is done by immunotherapy. So your entire immunity is preventing cancer. So a lot of emphasis on diet and physical activity, not only on weight loss.
So when weight loss happens without even trying, so I think that's a warning sign and one should see a physician for that, right?
Right.
And also, people complain of swallowing food with difficulty and they feel a lump in the throat. And I'm sure they tend to ignore it for a long time, thinking that it could be acidity, and they avoid spicy food. So what do you have to say about that?
So my advice is, if there is any difficulty in swallowing which is not subsiding over a period of time, definitely meet a gastroenterologist, see for an upper GI endoscopy if there is anything wrong. And after that, if everything is fine, then probably we can ignore. There's something called as carcinoma esophagus, means the cancer developing from your food pipe. So that presents in a similar way. So we need to be aware about that.
So it's important to be aware of the more dangerous thing and not take it lightly until, it's diagnosed. Yeah. So do people often say, oh no, I should have seen you earlier, or I should have seen a doctor earlier, and not ignore or tend to sit on the symptoms. How often do you think that patients feel this way?
It happens every time. So the main problem is, like, when you diagnose it too late, when you go for a regular checkup, you find out some problem is there. And eventually it is diagnosed in advanced stage of malignancy or advanced stage of cancer, what we say. So the first question what we are asked is how it happened. I mean, I was absolutely normal. Then now you're saying I'm having an advanced stage of cancer. So it is difficult for the patient to understand. So that is the main reason world has moved towards screening. Screening is that test which is done in normal individuals. It is without any signs and symptoms of cancer. So you do those screening tests to find out the cancers in very early stages. So if you intervene at that point of time, it is almost curable. So that is a problem with our Indian setup, where we go to doctor very late. So I think now the trend is changing. We are seeing a lot of screening mammographies being done, diagnosing the tumors in very early stage. We are happy with that trend.
honestly, you can tell me, as a doctor, do you undergo all these screening tests regularly?
At least after coming into oncology, I'm sending all my relatives who are crossing age of 40 to mammography and pap smear definitely from the age of 30 at least, if not 20s. And I'm asking all my relatives and all my friends to encourage HPV vaccination from an early age.
So now comes the most important question, especially for women, that is postmenopausal bleeding. I'm sure most of us tend to ignore, thinking that, it's just the hormones which are playing and, this will settle on its own.
It's a very important question because almost always, until and unless proved otherwise, postmenopausal bleeding always leads to some problem. Means either it's dysfunction uterine bleeding, there's something problem with your endometrial lining, or otherwise it could be an endometrial or a cervical cancer. So any bleeding which is coming after the age of 45 or after your menopause definitely gets a gynecological consultation. It's mandatory.
Another important thing is, a mole. So we have people who develop new moles in different places and, the change in size or the color.
So any mole that is your birthmark, so any mole which has recently changed in size, any new change in its border, any new change in its color, or any new ulceration or bleeding from that mole can become a melanoma. Although it is quite rare, but it is actually important because melanoma is life-threatening. So if you diagnose melanoma in a very early stages, actually we have very good outcomes. So any mole which is presenting with these kind of changes definitely needs an evaluation.
So as we are talking about preventive screening, so it means that cancer is no longer a death sentence, but it can be cured and conquered. So how do you see the future of cancer evolving, doctor?
Unfortunately, the numbers which is estimated by 2030 is like within 5 to 10 years, we are going to have probably cases in millions. More than probably 2 times of the last 10 years incidence. So cancer cases are definitely rising. So the good thing is now people are more serious about screening. So definitely in future there is a positive trend towards screening. I expect a lot of early cases, lot of screening mammographies, and lot of cancers presenting very early stages, and lot of patients getting treatment and cure. So I think it's both ways. Like we see a lot of cancer cases in future, but also a lot of early stage detection, early treatment, and early cures. That is quite that's a positive trend at least.
So having watched cancer so closely, are there any conscious habits that you are following now?
I recommend some important tips to prevent cancer. So mainly it is associated predominantly with your diet. So diet and physical exercise are the two important things to prevent cancer. In diet, it should be the emphasis should be take as much fresh food as possible. Lot of vegetables, lot of fruits. They contain antioxidants and good fiber content. So that will prevent lot of toxins like being in the food. Physical exercise, at least 30 minutes of walking or mild exercise for at least 5 days a week. I think that would be sufficient to prevent cancer.
It would be interesting to see how your plate looks like.
Okay, so my ideal plate, although I do it very rarely, but my ideal plate would be some portion of either minced beetroot or carrot, because it has a lot of fiber. It is good to your gut bacteria as well. So a shredded either beetroot or cabbage, some boiled quinoa, or one boiled sweet potato, and some fruits along with some rice and dal. Rice and dal is a good combination for a balanced protein. So rice and dal, and sometimes you take boiled egg or chicken, which is either like air fried or moderately fried, sometimes curry. And in the weekends, probably some seafood. So I think that is the healthier way. And there's one more important thing is avoid red meat as much as possible. So red meat is commonly associated with colorectal cancer. So red meat in moderation is very important because Telangana is known to
Have more
of red meat, and that too fried meat now.
So what are some common myths that you usually come across? I'm sure one of the most common question asked is, is cancer always genetic?
Oh, that's a very good question. Cancers are not always genetic. majority of the cancers are sporadic. Sporadic means it happens incidentally. It is not with there is no fault in your genetic line or
No family history,
no
nothing
family
in the
history,
genes.
no. Unfortunately, risk factors are all 50-50%. Some patients you don't find any risk factor, but you still end up having a cancer. That is because of our diet, background, radiation, all those contribute into cancer. So only few cancers are hereditary, around 10%. So what are the subtle signs where you think of hereditary cancer? Is cancer presenting at a very, very young age, probably less than 40 years, and multiple cancer in your family. Then we have something called as CGP, comprehensive genomic profiling, where we analyze the tumor tissue of the patient. We see for any genetic mutation, and we see the risk associated with the genetic mutation.
So that means, you could be having a perfect day, you could be just working, enjoying your day, hitting the gym, and suddenly you get diagnosed with cancer, and there comes the boom.
Yeah. There's one actress who spoke about this thing in 2018. So she's a very popular actress who worked in Telugu and Hindi film industries. So she had persistent back pain. She went to a doctor. She was advised conservative management with medicines and physiotherapy. Unfortunately, back pain did not subside. After that, she again went to a different doctor. Then MRI was done, which was suggestive of some problem in the bone. So after a deep workup with an oncologist, she was diagnosed with stage 4 cancer. So you associate like actress and models, they have a perfect diet without any risk factors and all, but still they end up having cancer. So that is the important thing of cancer. Like it can happen to anyone at any age.
So if you were given some superpowers today, what is that one thing you would do in the field of oncology probably?
If I have a superpower, I would change the stigma of cancer. So I would encourage people to go and meet and discuss about cancer. So if there is any, now the situation is such that even if you have a cancer in your some family member, people are hesitant to talk about it. They feel so ashamed and that stigma is still there. So if I have a superpower, I would like to change that.
So don't live in fear and don't Google endlessly. And it's important to talk to your doctor if something feels unusual. Am I right?
I think that sums it up properly.